Welcome to Logical Ayurveda. Today is a special day for us. It has been 1 year since the channel was established. It was established in an aim to enlighten and ignite young minds of Ayurveda. With the same aim in mind, we have added a special speech from our Guru, Dr. Pradeep, without whom all of this is impossible.
How to approach a disease. This one sloka is more enough to understand the approach of disease. Dosha eva hi sarvesham roganam eka karanam yata pakshi paripatan sarvataha sarvam apyaha. During the daytime, a bird cannot go away from its shadow. Like that, a disease cannot stand aside from the influence of three doshas. The disease we address may have several names, but be sure there must be a variation in dosha which is provoking the disease. Let it be a heart attack, diabetes, cholesterol, thyroid, maybe corona. There is a change in the dosha which is making the disease. As an Ayurveda physician, just observe and find out the dosha which is causing the disease, and you can treat a handful of conditions effectively. Maybe in a structural deformity, a need for surgery is unavoidable. But when it is functional, and especially when all the modern investigation fails to find the disease, we can do miracles. What you have, you see. If you have hormones and chemicals in your understanding, you will see only that in the patient. If you have three doshas, then you will see three doshas in the patient. That is why we have to unlearn certain things to understand Ayurveda in its purest form. When you try to follow a modern disease, or if we have to say aptly, when you try to understand a disease with a new name, never go with the symptoms. Symptoms can appear because of various causes. If we see in Kasa and Swasa, when patient complains phlegm, we cannot take it granted as Kaphaja Roga and prescribe Ushna Ruksha Dravyas. Instead, we have to understand it like, if it is less phlegm with dry cough, it is Vata, yellow colored phlegm with foul smell, then it is Pitta, and thick whitish phlegm will be Kaphaja, and accordingly we have to write the prescription. And without understanding the Nidana and Samprapti, that is pathophysiology, we cannot decide the underlying dosha. So it is better try to understand how the symptoms arose, or what caused the disease, or how the disease reached this particular stage. For example, if we see the varicose vein, we don't have a direct correlation from our text, and we have to interpret it. If you see the symptoms, lakshanas, it looks like granthi. And many times we end up doing symptomatic treatment, just letting out the infected blood. Instead, if we look the pathophysiology, it goes like the veins loses its elasticity, and so the valves won't close properly. As a result, the blood won't go up, instead gets settled in a valve. That's the reason Western science also advise stockings, because it helps the vein to be intact, and so the varicose will not get complicated. And even the surgery, they pull the vein and try to refix the elasticity. So if you search this in Ayurveda, we can find it in SIRA VATA, where it mentions VATA will loosen the SIRA. And now we can interpret this with varicose, and the treatment suggested is Upanagasvedana. So maybe after letting the blood out or healing the infected ulcer with oral medication, we can administer Upanagasvedanam to give a complete result. So this is just an example. If you see piles as a collection of inflamed tissues, we don't have much medicines to prescribe. Instead, you understand it as arshas. It starts from Amashaya, and we have a handful of medications. So instead of symptoms, try to understand the roots of the disease, and you can see Ayurveda there. I remember when we attend seminars and very old Vaidyas came there to take lecture. Sometimes the students ask very big questions, like 15 minutes they make their questions alone, but there will be only one answer to the senior Vaidya. Just see the dosha and treat it. So remember, whenever a patient says something, he is not saying the disease. So don't make prescription by bits. Instead, understand like he is saying the karma of the underlying dosha. From there, it is our goal to find out the status of the Agni, Koshta and underlying Dhatu, Dosha, and try to imagine a script for his disease. What he has done, Nidana, where it impacted Dosha and Dhatu, and how they reacted, that is Lakshana, and the whole thing will reveal the Samprapti. And just reversing this process is treatment. After scripting the whole thing, now make your prescription, and you should also have an image of how it is going to work and wait for the expected result.